One of my favorite topics to talk about, I just absolutely love it, is the most abused diagnosis, and that's heartburn or acid reflux. It just drives me nuts when babies are put on Prilosec because they have acid reflux. That's a terrible thing. I'll start out the discussion with a patient named Elena. She was in her mid-70s and was diagnosed with Barrett's esophagus by her gastroenterologist. Barrett's esophagus is precancerous tissue in the esophagus. The doctor said that it was all from acid reflux of acid going up the esophagus, burning it. So she comes in to see me and she wants to know if I can help her. And so I did my blood testing on her and found out that she didn't have enough chloride in her blood, which meant that she wasn't able to make enough hydrochloric acid. On top of that, her doctor put her on Prilosec, which is a proton pump inhibitor, which stopped the production of acid in her stomach. The doctor said acid is the reason why you're bad. So of course, in my oddity, I said to Elena, Elena, the reason why you've got a problem is because you're not producing enough stomach acid. And she goes, but my doctor told me that if I have more stomach acid, I'm going to get cancer in my esophagus. Well, I said, let me give you an analogy. If you took a furnace and you put a tree stump in it and you turn down the heat, that tree stump would be inside that furnace for a really long time. If we took and turned the temperature of the furnace up, then what would happen is the tree stump would burn very quickly. So the goal is to take and give you betaine, which is hydrochloric acid, when you eat your meal. And what I want you to do is you take that before you eat. That goes in your stomach, you pile your food on top of it, and that would take and increase the temperature inside your stomach. Now when it does that, that means that before you go to bed, you would be done digesting it. So when you lay down, then you don't have the acid going up into your throat. Well, she told her doctor, and the doctor called me and got mad at me. And he said, you're going to cause her to have esophageal cancer. And I said, well, let's just see what happens. He says, I don't know if I want her to do that. Well, I said, I think that she is going to try something different because she's had this esophageal problem for a long time. So I put her on it, and he says, in 3 months, I'm going to take and do a scan, and I'm going to take and show you that she's worse. Well, in 3 months, Elena didn't have any stomach acid reflux anymore. She was going to bed, not having any pain. He retested her esophagus, and her esophagus at that point in time had healed because she wasn't going to bed still trying to digest because it was ineffective digestion caused by less stomach acid. So sometimes we think that a sour stomach is because we have too much acid, and I think that's just a big fallacy that the pharmaceutical industry would have a tendency to do that because they can control the production of it. But I don't know any stomach that was never made to make stomach acid. And stomach acid is critical for breaking down those nutrients so those nutrients can actually get into the body. When the doctor did the test and the esophagus was clean and the cells had healed, he really didn't want to know what I did extensively because he didn't. Medical physicians are not necessarily bad. They just have a protocol. They have a standard of care that they do. And in functional medicine, what you do is you take and try to help the body do a better job of what it was designed to do originally. Pharmaceuticals are made to control body function. The side effects of pharmaceuticals are the groaning of the body being controlled. When you take and stop acid production in the stomach, like a really good funny thing is Tums would advertise that you take that to reduce stomach acid. The problem is that if your stomach isn't acidic enough, then you can't break down calcium. And if you can't break down calcium, then you're flushing your calcium down the toilet. They put calcium in Tums to try to say that it's going to build your bones, but without your stomach getting hot, you can't break down minerals. So without breaking down minerals, then you have all your minerals not getting into your body. Again, it's all stemmed from you have to allow the body to do the process that it was designed to do, and that is it has to produce acid. And salt is a really big key to that, isn't it, Dr. Hill?
Mm-hmm. Yeah, so
yeah.
The important aspect of that is the fact that salt most of the time contains chloride. Chloride is a building block for hydrochloric acid, which is stomach acid. Making sure that we understand, as Dr. Hill stated, that the stomach is tasked with the initial stages of digestion, and if it can't do that efficiently, providing nutrients that are needed for it to do that is actually a really important step to take. To go back to the initial question, what causes indigestion? What causes acid reflux or heartburn? Oftentimes conventional wisdom will tell us that too much stomach acid is the issue, but what we found and what has helped a ton of our patients is taking the opposite approach, or looking at their blood levels of certain nutrients and realizing that they're actually not producing enough stomach acid to adequately digest their food. And when that happens, usually the byproduct is the food sits in the stomach and it churns, and really the only direction it can go is back up if it's not ready to go down to the next stage of the digestive process. Once again, full spectrum, understanding the nature of who the individual is and what their individual lab numbers are is a very important first baseline to get. From there you can help them with things like acid reflux or indigestion in a pretty straightforward way.
And you were talking about eating good food. If you put cardboard into the stomach, it's not going to feel good and it won't do well. The more man changes food, right? You get a problem when you put bad food in the stomach, and then you complain about that my stomach doesn't feel good. There's always a reason why it doesn't. There's the cause and effect with everything. Yep. So eating a good diet, good normal food, healthy food, a Garden of Eden food. The closer pulling it out of the ground and eating it from that, you'll do better than having it go through any kind of process that man has. The sad thing is that all the expensive food is on the outside of the grocery store, and all the bad stuff is all on the inside. And that's the stuff that probably 90% of people buy because it's convenient. People don't cook anymore. People don't know how to cut up vegetables. They don't do anything to help themselves in that regard, and that has a very big effect on a bad feeling stomach or acid reflux, because the stomach won't do well when you put something that it can't do well within it.